questions, make it. Thanks everybody for joining us today. So we're talking on this webinar about effective health and safety management and the importance of health and safety management in the workplace. So myself, I'm Tracy from HR Prime, and I'm also joined by Alex Duggan, who is a health and safety and business continuity expert consultant. So between us, we'll be talking you through why good health and safety management is important. So it's a question that's on every business owner's mind, and obviously something that is important both in terms of legislation, but also in terms of good employment practices. So some of the things we'll be looking at today will be around risk assessments, where risks come from, so what creates a health and safety risk, how to assess your workplace. We'll be looking at managing diverse workforces, and just talking you through that process. So the first few slides will be me. Well, I'll give you a bit of an overview more from an HR perspective, and then I'll hand you over to Alex, who will talk you through kind of the detailed health and safety sides. But like I say, if you've got any questions, please do ask them as we go. So when you're looking at health and safety, one of the key things that's important to remember, and one of the things that we find very often is overlooked, is as soon as you employ 5 or more staff, it's important that your policy is written, and is documented. So for some businesses, that's 5 or more people on the payroll, which may include your directors, or people that you wouldn't necessarily count into that headcount. So just make sure that you're aware of the legislation around producing policies. Everything health and safety related is covered under the Health and Safety at Work Act 1974. And that says that you need to risk assess any dangerous activity. And that's both to review the measures and mitigate the risk. So like I say, Alex will talk you through that in a bit more detail later. But the main thing with health and safety to remember is it needs to be proactive, not reactive. So looking at how you can mitigate risk and how you can stop those concerns from happening before they happen. Obviously, there's always a reactive element, so if an accident happens or an incident happens in a workplace, you will always be managing that reactively and kind of dealing with the associated issues. But a lot of your health and safety action needs to be in advance and preempting what could happen. And we will talk to you a little bit today about RIDOR, which is something that you may have heard of. And that is a list of requirements that if an accident or an incident falls into these regulations, and it's the reporting of injuries, diseases, and dangerous occurrences. So it's a list of things that come under RIDOR. And just make sure that you do look at that list. And if you're in any doubt about reporting, it's better to report than not to report, or at least to make that call and ask for advice. And the HSE will let you know if it's reportable. Now, again, Alex will talk to you about this in a little bit more detail, but from an HR perspective, of risk assessments can happen for many different reasons. And some of them here in yellow. So you may risk assess something that's a job specific task. So something that person does just in their job, like driving, like working at height. At the bottom there, like DSE. So anybody that's working on display screen equipment will need a risk assessment. And then there's other reasons that you may do a risk assessment, which might be permanent or temporary. So somebody may be diagnosed, for example, with a disability or some kind of ill health, which is going to have a permanent effect on their ability or their capability. And you may do a risk assessment to look at adjustments and to look at how you can support them. There'll be other areas that you'll risk assess, which will be temporary. So, example, where a lady is pregnant or somebody has a short-term injury, they might have a broken leg, for example, but you might want to risk assess their fire escape or risk assess how they get up and down the stairs. So not all risk assessments will be forever, but it's really important to remember that even the ones that are permanent, situations and needs change very quickly. So don't fall into the trap, I guess, of doing a risk assessment and thinking, well, I've done that now, I'll put that in the file when it's done forever. Because things do change, needs change, situations change. And then there might be some specific areas that you might risk assess. So things like mental ill health, sexual harassment certainly is a big area at the moment that companies are risk assessing on. Um, and as I said at the bottom, remember it's only valid when it's undertaken. The other thing we would say from an HR perspective is don't fall into the trap of thinking, well, every person with a certain disability has got the same needs, or every person with a certain neurodiversity has got the same needs, because every single person will have their own needs and their own requirements. So it's really important that you look at every case as an individual basis and think about the adjustments that that individual needs, not what that illness or requirement needs. Now, when you're managing workforces, as we said a moment ago, there's lots of different reasons that you might risk assess. And some of those reasons are on here. So you may risk assess those with a disability. You may risk assess staff who have neurodiversity. So, for example, autism, ADHD, anything else on the spectrum that may affect their performance. You may assess staff who are suffering with mental ill health. And you may have women in your team who are going through the menopause, who are suffering from symptoms of menopause. So any of these conversations may trigger you to think about adjustments. We've also got on there ethnicity and race, which in itself wouldn't be a risk assessment, but it may be something again that you want to discuss adjustments and support with an individual. So, for example, if you've got people in your team who don't speak English as the first language, you might want to think about their understanding of things like health and safety policies. You know, do they understand the emergency procedures, for example? Are there cultural issues where you may need to have conversations around how things are done? And at the bottom there, we've got young workers. So some of you may employ young workers. In the eyes of the law, a young worker is somebody under the age of 18. But there are specific requirements if they're still at school age, so if they're under the age of 16. And that would be requirements around things like their breaks, their working hours, their working conditions. So when you employ any member of staff or when a current member of your staff comes to you with any issues, just ask yourself, is there a need to do a risk assessment to kind of look at those and evaluate them? Just a quick reminder here of the protected characteristics. So under the Equality Act, these are the characteristics that can lead to or can be classified as discrimination in the UK. So age, disability, gender reassignment, marriage and civil partnership, pregnancy and maternity, race, religion, sex and sexual orientation. So when you're thinking about risk within the business, these are the legally classified discrimination categories. Now, obviously, a moment ago, we touched on menopause as being a really good example, which isn't on here as its own protected characteristic, but almost certainly would fall into age discrimination and sex discrimination, for example. So there may be things that could occur or that you need to consider that might not typically fall into this list, but still be mindful of, you know, of discrimination and protected characteristics. Just a quick run through of discrimination for you. Like I say, we won't spend too long on these, but it just puts the kind of health and safety and the risk assessments into context. So direct discrimination is when you very directly discriminate against one or more groups. So you may say, for example, a fit, healthy person or a fit, healthy man is required to work in this company. You know, you're directly discriminating against those who are unfit, unhealthy, or not male. Indirect discrimination can be a little bit more subtle. So thinking along the health and safety lines, if you advertise a job, for example, that says, we need somebody who is capable of climbing ladders, that will indirectly discriminate against potentially those with a disability or those who are not able to climb ladders. Now, that may be perfectly justified because you may be able to justify that the job does require somebody to climb ladders. But if somebody were to apply who didn't fall into that typically fit category, you would need to look at adjustments and whether you could accommodate individual needs. And the next two don't really are probably unlikely to come up in the context of health and safety, but discrimination by association relates to where you treat a person differently because of somebody they are associated with. Very often comes up in cases like ill health or racism, for example, where you may have a culture in the office where there's lots of comments, lots of banter about a particular race. None of your staff may be of that race, but they may be married to somebody that is or have children that are, and they can be offended and discriminated against because of their associations. And then vicarious liability very typically comes up at Christmas, but it does come up in the context of health and safety, is where an employer could be liable for the acts of its employees. A really recent case which went through the courts, which we've discussed on a previous Lunch and Learn, was a member of staff working for Morrison's who assaulted a member of the public, punched him, kicked him to the floor. The ruling of the tribunal was obviously Morrison's didn't ask him to assault the member of the public at all, but he had his uniform on and he was acting in the capacity of his role, and Morrison's were found liable. So very often that does come up in terms of kind of health and safety, violence, some of those kind of areas. So just be aware of the types of discrimination that can exist and obviously how they could affect your company. Just a few stats here just to kind of bring to life what we've just said. So currently in the UK, 1 in 4 working age adults is disabled, and there's currently 5.1 million disabled people at work today. 78% of neurodivergent workers regularly feel overwhelmed at work. So these stats show that statistically, you're very likely to employ um, individuals with a disability or with neurodivergence, perhaps without even being aware of that. And that makes it even more important that your policies and your cultures are inclusive and make that workplace accessible for people. Looking at menopause, nearly 8 out of 10 women will go through menopause whilst they're in your employment. And the effect of that, can range from very low level anxiety, very low level temperature change, through to really serious conditions, brain fog, anxiety, low mood. And again, statistically, if you look at your workforce, it's very likely that you will have women within your teams who will go through menopause at work. And for those of you that don't, it's very likely you may have wives, partners, relatives, friends that will go through it, which ultimately may then affect you. And then looking at mental ill health, again, 1 in 4 adults will suffer mental ill health at any point in their life. The number of workers who say that their mental health limits the type of work they can do has quadrupled in the last 10 years. And mental health at the moment is the most common cause of work limiting conditions amongst age 44 and under. So it's a really, really big impact. And again, if you look at your own teams and your own workforces and think statistically, 25% of those people will have a disability, 25% will have some kind of mental ill health, and 80% of your women will go through menopause whilst they're employed by you. It just kind of brings home how important it is to get your policies and your culture and your management practices right. And then just a little bit about how you can manage disability in the workplace. And again, some of this Alex will cover later in the terms of sort of health and safety. Think about reasonable adjustments. So if somebody is covered under the Equality Act for any of the reasons we've spoken about, the law requires you to consider reasonable adjustments to their role. Now, that could be things like changes to their working hours. It could be looking at their responsibilities, their location. The really important thing to remember here is that you are required to consider the adjustments, not required to make them or to agree to them. But you do have to be able to evidence how you have considered them on a very individualized approach. So, like we say, you can't have a policy that says we don't let anybody change their working hours ever. And when you're challenged, your response is, well, that's just our company policy, because that won't hold up in a court of law. It's not considering the individual's needs. There is a scheme called Access to Work, which some of you may have heard of, and they can provide financial support to help disabled people to stay in employment. So it's certainly worth thinking about an Access to Work referral if you are struggling with the cost of adjustments. And the other thing to be mindful of is to constantly refresh and update. Like we say, situations will change, disabilities will change, people's health and mood will change. You could talk to somebody today who's absolutely fine, but by tomorrow they may not be. So just remember to keep kind of an open communication with them and stay open-minded to changes that may come. And obviously, sometimes they may be changes for the better. People may recover, they may get better, but equally things can progress in the other direction. Just a really quick slide here that kind of sums up everything we've said. So we often say to people, think about equality and think about equity. Lots of companies say to us, well, we're really good on equality because we give the same resources to absolutely everyone, regardless of the detail. And we're saying from an HR perspective, from a risk perspective, that's probably not the right way to go. You probably want to think about equity instead of equality. So a really simple graphic there to put it into context. If you give every member of staff 2 boxes, your tall people are still tall and your small people are still small. But if you tailor the number of boxes that they get, depending on their height and their requirements, everybody can see. So just think about, you may have the best policies in the world that talk about your consistent management, but they may not work for the people that need them. And then there are some legal changes coming up at the moment. And the Employment Rights Bill focuses very much around making work pay. That's been Labour's motto all the way through. And they are bringing in lots of things that will make work better and make work more accessible for employees. Now, on the back of that, inevitably, it creates more work for employers. So thinking about things like your probationary processes, your absence management processes, sexual harassment processes. And just a quick question there to say, does everybody know what the sexual harassment changes will be? We can obviously give you more details separately if you need it or if you want to sign up to mailing lists. But sexual harassment law is changing in the effect that it will no longer be enough to manage problems when they arise. Employers will have a responsibility to proactively prevent and to take all reasonable steps to stop the cases from happening. Now, in addition to that, sexual harassment legislation is expanding, and it will now not only cover your staff, but it will also cover clients, contractors, third parties, members of the public, wide reach. So we're saying to companies, do a sexual harassment risk assessment, look at what the risks are. Certain areas, if you're working in hospitality, for example, there's obviously a lot more risk. If you're working in a community-based environment, there's risk. A lot of companies where they may not appear high risk on paper, but garages, building sites, the companies that statistically have the banter, the very one gender or another dominated workforces. So just think about where your risks are and make sure that you've got plans in place to mitigate those risks. Like I say, if you need any particular help with that, let us know. But it is a really important area that's changing really quickly. And then just a few legal considerations. So everything we're talking about today will fall into one of these laws. So the Health and Safety Act 1974, the Equality Act of 2010, or the Working Time Directive. And the Working Time Directive will look at things around sort of breaks, annual leave, working hours, which obviously affects the other two in some way. That's the end of my session. So I will stop talking in a moment and pass you over to Alex, who will talk us through kind of more of the health and safety business continuity side of what we're talking about today. Has anybody got any questions on anything at all that we've covered so far? Or any burning questions for Alex before he starts? No, you're all happy. Excellent. I'll hand you over to Alex then. Alex, all yours.
Thank you very much. Thank you. I hope you can all hear me. Apologies if I've been coughing a little bit as well. I'm just getting over a cold. So just about myself. I can't control the slides, Alison. That's fine. So health and safety is about preventing harm, physical, psychological, organisational, and it's about identifying the risks and managing them, as Tracy said, proactively. So we want to get the hazards and the risks before they start harming people. So in modern organisations, health and safety does go beyond hard hat fire exits, the traditional health and safety. Just a bit about myself. I've got 34 years experience in health and safety. I've worked both internationally and in the UK, in the Middle East, Africa and Australia. I'm NEBOSH qualified, and I've also got qualifications within business continuity as well. So I'm a member of IOSH IIRSM, which is the International Institute of Risk and Safety Management, and the Business Continuity Institute. So the objectives for today is to just develop a clear understanding of health and safety foundations, including key principles, legal requirements, and responsibilities. Looking at practical approaches to health and safety, we're going to look at risk assessment in a bit of detail and to examine the impact of effective health and safety management on organisational performance as well. So why does health and safety matter? Well, ultimately, we want to prevent injury and loss of life in the workplace. That is ultimately what we want to do. Before modern health and safety laws, and there was a lot of changes in the 70s that started coming in. Before that, we had the old Factories Act. In 1974, the Health and Safety at Work, etc. Act came in. And then in the early 90s, we had something called the Six Pack, which brought in a whole host of health and safety legislation after that as well. So before that all happened, people were losing limbs, getting poisoned, dying regularly, especially in the factories, mines, constructions, and the high-risk industry like that. It is a legal obligation, not a recommendation, and I still hear this on sites. Health and safety is just a 90% recommendation, somebody told me the other day. It isn't. Under the Health and Safety at Work Act, employers must protect employees and the public. Ignore it, we're looking at unlimited fines, directors personally prosecuted, and prison in serious cases. The HSE don't mess around. The HSE these days are self-funded. They've got their fees for intervention, which the employer must pay for. Currently, the fees for intervention are £183, I think it is, per hour. So those fees can seriously rack up. And it's economically prudent as well. Workplace accidents in the form of sick pay, compensation, insurance, premiums, downtime, investigation, regulatory fines, etc. So basically, health and safety measures are often less expensive than managing the consequences of the incident. It's also expected by courts and insurers. In the event of an incident, touching on what Tracy was saying, the courts are wanting to know what you have done about health and safety. Can you demonstrate adequate health and safety risk assessments, training, control measures? If you can't, then you're open for liability as well. And we should also point out that the nanny state perception is largely exaggerated. Health and safety, unfortunately, has had a bad rap over the last few years, where things like limitations on ladder use or bans of games on like conkers that hit the headlines as well. And these are myths. They're also often the result of things like misinterpretation of regulation, overcautious practices, and misattributed rules as well. UK law does explicitly require that health and safety is reasonable and proportionate. You might have heard the term as far as reasonably practical. So we want to put in rules and regulations, control measures as far as reasonably practicable. We can't get rid of every hazard. We can't get rid of every risk, but we've got to manage those as far as reasonably practicable. So health and safety in the UK is about sensible prevention rather than excessive caution. When applied appropriately, it operates unobtrusively. When neglected, we're going to have a problem. So common challenges and misconceptions that businesses do face. Things like leadership buy-in can be inconsistent. Safety is treated as paperwork, not practice. Great, we've got a health and safety management system. Aren't we wonderful? It's there for the HSE when they walk in. But it's got to be then applied within the workplace. Heavy focus on policies, forms, and audits rather than what actually happens in the workplace itself. Risk assessments exists, but again, they sit on the shelf, gathering dust, and they're not doing anything. As Tracy said, the risk assessment process is a live process, and it continues to be a live process. It's also important to get worker engagement as well. So getting employees involved in hazard identification and decision making. Whenever I do a risk assessment on site, I always involve the employees because they're the experts in the machine. I don't know how a CNC milling machine actually works, but they do, and they know the risks that go with that. So it's important to involve them in that process as well. And safety feels imposed on them and not built in with them as well. And that's the same for anywhere in the organisation, to actually make safety as part of the organisation, not as an annoying bolt-on as well. The competency gaps, making sure that training is part of the organisation, that coaching goes on within the organisation as well. It's not a tick box exercise. And supervisors are expected sometimes to manage safety without being properly equipped to do so. Again, making sure that they are trained, coached appropriately as well. Some misconceptions. Health and safety is just common sense. Well, yes, it is partly common sense. There's a lot of common sense that does take place, but it's not just that. So many serious incidents happen during routine tasks. People get complacent. People are doing the same thing every day, and sometimes we can find that something happens within that. And risk perception, and I'll touch on perception a little bit later on, varies widely between people as well. If we comply, we're safe. Compliance is the minimum, not the goal. We want to get to the minimum of compliance, but then we want to grow the company as well. Like any ISO, it's continuous improvement. And the HSC prosecutes organisations that were compliant on paper but unsafe in practice. So again, the HSC are out there. The HSC are visiting workplaces at the present moment in time. So we need to make sure that's in place. If there's no accidents, the system works. Again, we want to make sure that companies use both leading indicators and lagging indicators. The lagging indicators, the injuries, what's actually happened, just don't show the underlying risk. If we use the leading indicators as well, like looking at near misses, which is a potential for an accident to happen, then we need to look at that in the workplace as well. So it's looking at the bigger picture. And health and safety is the advisor's responsibility. Again, I get this a lot on sites. Great, you're looking after my health and safety, it's all yours. No, it's not. I'm your advisor. I will advise you with your health and safety, but the actual responsibility for health and safety remains with the employer. So it's very important that that is in place as well. So in terms of managing risk, as an employer, we are by law, you have to protect your employees and others from harm. As well as the Health and Safety at Work, etc. Act, we've also got the Management of Health and Safety at Work Regulations 1999. And this is what governs risk assessment within the UK. We need to identify what could cause harm or injury in the workplace, your hazards, decide how likely somebody is going to get hurt and harmed, and how serious it's going to be, your risk, and then we take action to eliminate the hazard, and if not, that's possible, control the risk. So we've got our control measures as well. So what is hazard and risk? Well, hazard is defined as the potential to cause harm, damage, or loss. Risk is the chance, whether it's high or low, that somebody could be harmed by the hazard, together with an indication of how serious the harm, damage, or loss could be. To explain that a little bit better, there's a nice little graphic here. The hazard, we're looking at a shark and thinking, should I go swimming in that sea if I can see a fin? If you decide to go swimming in the sea, there's a likelihood that that fin does belong to a shark and it's going to hurt you. So it is making sure that we do have that. So why don't we always do the right thing? Well, it's very, very simple. I put this graphic up sometimes and I get some great answers back. But it is very, very simple. We're human beings. And we all have, as I touched earlier, we all have a very, very different perception of risk. Our perception of risk is different for everyone. And these are 4 examples of things that are risky, but people do it, whether it's wing walking, shark diving, bungee jumping, or window cleaning on a high-rise building. Some of us will look at that and go, "Oh, that looks fun." Others might look at it and go, "Oh, no chance, not a chance of that at all." None of those appeal to me, by the way. Possibly shark diving, but that's about my limit. But we've all got that different. Tracy might have a different look on that. She might be going wing walking. I'd love to do that. So we don't know, but we've all got a different perception of risk whatsoever on that one there.
Sorry, let me just move the slides.
No worries. There we go. So once we've identified the hazard, we will have to undertake a risk assessment to decide how likely it is that someone could be harmed, excuse me, and how serious it could be. So this is determining and assessing that level of risk. So we decide who might be harmed and how, what you're already doing to control the risk, looking at our existing control measures, and they might be good, they might be absolutely fine. We might not need to tweak on that. But if we do, then what further action do we need to take to control those risks? Who needs to carry that out to the action when it's required by as well? And we can use something like a very simple, this is a 5x5 matrix, I'm sure you've all seen it, a Boston Squares it's sometimes called, which looks at severity, versus the likelihood. Simplest way of putting it, who could be harmed by this and how bad is it going to be? So what's the likelihood of being harmed? What's the chance of being harmed? How bad is it going to be? And then we do this on like a 5x5 or whatever type of model that we use, and we can get a perception of of where risk actually is. Now, risk assessment is ambiguous. It's subjective, sorry, I should say, rather than ambiguous. It's subjective. One person, as I said, with perception of risk, one person might see the risk being absolutely safe, another person might see it as being dangerous. So it is subjective, and then we can put that together. In terms of risk control, pardon me, apologies. Once we've carried out a risk assessment, we need to control the risk. Look at already what we're doing already, what we already have in place, and then we ask ourselves, can I get rid of the risk altogether? If not, how can I control those risks so the harm becomes unlikely? If we do need further control measures, consider looking at redesigning the job, replacing materials, machinery, process, organising the work, and touching on that Tracy was saying, to reduce the exposure to the materials and also to redesign the actual job for people. We might be able to look at something like that. Identifying and implementing practical measures and providing personal protective equipment, making sure that people wear it as well. And personal protective equipment is the last resort. And I always look at this this triangle, I always describe the hierarchy of control by putting my arms right out. When I put my arms right out, that's basically we want to eliminate the job. If we can eliminate the hazard altogether, then absolutely fine, we get rid of that hazard. Then we start coming in towards the body. Can I then substitute the risk for something less harmful? So if we're using a chemical, for instance, is there another chemical out there that does the job, but is a bit safer? Then we bring our hands a little bit closer to the body and we look at engineering controls, guarding on a machine, for instance, making sure that the guarding is working, the guarding is in place, and people are using it. Then we bring our hands a little bit closer to the body again, and we're looking at administration controls, our procedures, our policies, our permit to works, all the documentation. And then the hands are on our body here because that's our PPE. That is our last resort. If the PPE fails, you're getting hurt. So it's trying to push that hazard away from you as much as you possibly can. So once we've done that, we can then assess the risk, apply the control measures, and then we must record the findings and we review annually, or if a significant change has taken place. And that could be people, it could be an incident, it could be a procedural change, it could be anything. But they should be reviewed on a regular basis. And it might not be reviewed annually. You might look, what's a high risk? I need to review that every 3 months. It depends on what it is. So a little example there, so slip and falls in an office environment, and what we've done about it, what's in place already, what can we do to enhance the protection of that risk, who's affected, and then the date against that as well. So key insights, how health and safety does affect employees. Things like physical and psychological well-being. Good health and safety does reduce injury, ill health, fatigue, and stress. Again, looking at the psychological safety as well. Psychological safety, feeling safe to speak up, is as important as the physical safety. The takeaway here, employees who feel safe are more alert, engaged, and resilient. They feel part of the process. Trust and confidence, consistent safety behaviours from leaders build trust. When I'm on a site, I often say to the senior management, come on, let's go for a walk around the site, because it gets you out there as well. It's visible. You can see it. You're taking interest in it. Ignoring safety concerns signals that people are expendable. So trust in the leadership is strongly linked to safety performance and retention of staff as well. Empowerment. When people are involved in risk assessments and improvements, They do take ownership. And I said, when I'm on a site, I always involve the employees in risk assessments. They are the experts, not me. So I get them involved in that. I ask them, what's the biggest risk to this machine? How can we work with you? How can we improve this? I'm getting rid of any sort of blame culture as well. If somebody reports something, are they going to get blamed for it? So building strong health and safety foundations is important. And it is still important with the documentation as well, making sure we do have the right policies, we do have the training, we do have the reporting strategies, and we do carry out regular audits too. Effective HR and risk management practices, integration with recruitment, onboarding, and ongoing development, coaching. Absent management approaches, early intervention, support programs, return to work plans as good examples here. And then looking at leadership and management tips, leading by the example, visible commitment from leadership, getting people out there. Embedding health and safety in daily operations. Start off with a toolbox talk. I look after a local garage, and they start every day with a little toolbox talk. And they just get together for 10 minutes, have a chat about health and safety. And it's just a great way of just getting people involved with that side of things too. Performance reviews, KPIs, key performance indicators. What can we put in place like that? And encouraging open reporting and continuous improvement. Getting people to report things, getting people to notice things, and ensuring that there's no blame culture going on as well. So summary to this is health and safety is integral to everything we do, health and to people, to culture, to performance. It is critical to embed health and safety into leadership, into management, and everyday practices. And there's loads of resources out there. The HSC website is phenomenal. It's a great place to go. There's other government health and safety guidance. There's professional bodies. There's lots and lots of information out there too. Okay, thank you very much.
Thanks, Alex. That was really, really useful, really interesting. Georgina, we've got a hand up there.
Yeah, sorry, hold on 2 seconds. And then Alex can see me. Hi, Alex.
Hello.
I was here. I'm in the background. I'm working at the same time. I sent Tracy a note to say.
That's fine.
That's all right.
So risk assessments, etc. I'm IOSH qualified. I'm actually refreshing in a few weeks. So
Awesome.
it's an interesting one that just came up. We have usually a couple of days a year where we have a staff day. And we let people go out, we arrange something. So it's usually either a walk or a treasure hunt around a town, etc., etc. But we're always looking for things to do. And one of the things that's come up this year is someone has suggested a company that does axe throwing.
Okay.
So my CEO is going, how the hell do we risk assess that? Now, I know from previous works and things that I've done, because I've worked in project management for demolition and things like that, is that, you can ask for a risk assessment and method statement from the supplier.
You can.
But that doesn't mean that you're off the hook, does it? You have to have an assessment of your own for your staff.
Yeah, indeed. I mean, if it is a works outing, I mean, obviously if you're going to I'm assuming you're going to their workplace.
Yes, I think that's the idea. It's one of the suggestions, and obviously, it was sort of yes, okay, that's a valid point. Axe throwing is probably quite high risk.
It's an interesting one.
Yes.
It's certainly an interesting one. I mean, I think it is prudent that you do your own risk assessment as well, especially as you are a works outing too.
Yeah.
Because I mean, if you're just going as an individual to a place or wherever it might be outside your own outside work time, then obviously you wouldn't. But as you're going to an actual work site, if you like, it is prudent just to do your own risk assessment and ask them whether they have any sort of risk assessments in place as well.
Yes, well, that's
So
what I thought,
yeah,
you know, that they
and,
would have a RAMS
and
or,
I'm
you know,
assuming
at
that they will
minimum
have
a risk
their
assessment.
sort of PPE in place that people are not going to sort of throw axes or mess around or whatever else,
Yeah,
and it's a very controlled
yes, one would
environment. I will
assume,
be
but
honest with you, I've never done axe throwing. I'm not going to lie, but certainly it would be worth just getting your own risk assessment in place if you are going
yeah,
into another person.
that's what I wondered,
And
whether
I
that
think also
was,
thinking about the particular areas and that, if you might have somebody, for example, that's pregnant that can't take part, or people with
Yeah,
disabilities. So just risk assess the sort of the inclusivity aspect of it as well.
yeah,
that's a good point. That's a very good point to make, actually. Yes, that's a very good point too. And also, I mean, taking into account, I don't know what the situation is, whether there's anything like alcohol going to be involved or whatever it might be. Taking into account anything like that, just looking at the whole holistic picture.
yeah.
And if it's a work outing, so to speak, I don't know what's involved in that, but you need to look at the whole thing on that side of things there too, just to
Yeah,
make sure you've
Okay.
got the holistic picture.
sounds quite interesting though. Any other
Interesting.
Thank
Well,
you.
questions at all from anybody else? You're free to put your microphones on or pop your hands up or use the chat. No, what we will do then is finish up the session now and stop the recording. And as I said before, we're